Hello, ladies and gentlemen. Welcome back to Brain Gist. Today, I just want to touch a little bit on, a common question we get in the clinics, and that is the question of who needs to have a head MRI scan. So we get patients coming to the clinics with headaches and some other neurological problems, and they often ask us, "Do I need an MRI scan or not?" And in my mind, we've got two categories of patients in that regard. There are those who would not be reassured no matter what we tell them unless they have a head scan. And then there are also those who are reluctant to have a head scan even though they need one. And some actually come to the clinic, and when you ask them, as I'm in the habit of doing a lot of times, when I see patients, I ask them, what are your expectations from this consultation today, or what are your concerns? And some of them are very, very clear and expressive about what they want. So all they want is, it's not a headache per se that bothers them, but they just want to know whether they've got something serious going on. They want a head scan, and some say it outright, "Doctor, I've been having this headache, I've been having this dizziness, I've been having this feeling of imbalance, and I want a head scan, I want an MRI scan." So how do we decide who needs an MRI scan? So that's what I'll be discussing today. And if that sounds like something you would like to hear, if that sounds like something that applies to you or someone you know, then please do stick around till the end. And then you can see from the theme of the setting of this video, it's Christmas season again, favorite time of the year. And I'd like to wish you and your loved ones a Merry Christmas. I do hope you're fine and in health. I wish you a Merry Christmas and a happy 2025 in advance. Before I go into the content of today, I'd like to welcome you to the channel. It's Brain Gist. In case this is your first time, this is a fantastic channel where we educate people about the brain and brain disorders, and of course the entire nervous system, and of course once in a while some general health issues outside of the brain which may be germane to our lives and germane to our health. All right, so how do we decide who should have a head scan? Someone has walked into the clinic to complain of headache. A headache is one of the commonest complaints we evaluate in the neurological clinic anyways. And the causes of headaches, range from the most benign causes to the most dangerous causes. So how do we decide who should have a head scan? How do we send somebody home that you don't need a head scan, and then we're certain that we haven't missed anything and we have done justice? So I'm going to be laying this video on the foundation that a head scan is not everything. It's not a panacea, so to speak. It's not an oracle, so to speak, that tells people, "Oh, you go home, you're fine. You don't go home, you're not fine." The reason is, I'm not a very big fan of MRIs, first of all, because there are two reasons. One is that sometimes you do an MRI and it comes back normal, yet this person has a serious cause for their headaches that needs to be addressed. So MRIs are not everything. So MRI is not the only way we investigate and diagnose health conditions. Number two is there is also a chance that you may do an MRI and discover what is otherwise unimportant. Yet people lose their sleep because of that, because they found something in their brains, and people worry a lot about those things. So we call them incidental findings. And that's a very common cause for worry. And this is part of why I don't request MRIs indiscriminately. So now the other foundation I'm going to be building this talk on is the fact that MRIs in general, they do not necessarily solve all problems. So how do we now decide, right, okay, I forgot what I was going to say, now it's come back to me, and that's the value of the clinical assessment. Yeah, that's the third point I was trying to make. that, an expert analysis of your symptoms and a careful, knowledge guided clinical examination is far more valuable than just a picture of the brain. I will say that again. A well-trained neurologist or headache expert sitting down to listen to your story, asking you direct questions, relevant questions aimed at finding a diagnosis, and then going on to examine you clinically, that has more value than just a picture or an image of the brain. So that should be reassuring if he says at the end, or if she says at the end, that you don't need an MRI. That should be reassuring enough. All right? So having said that, the path we follow in a neurology clinic is, first we take a comprehensive history of your symptoms, be it headaches, dizziness, or whatever it is. We do a comprehensive assessment of the symptoms. We ask all the relevant questions to help us arrive at a diagnosis. And then after that, we go on to do a careful clinical examination to look for signs that will guide us to the diagnosis. And truly speaking, at the end of the history and examination, 85% of what we need is already obtained. So we don't just put people in the MRI and then the MRI tells us what is there and then we'll follow. That's not what we do, actually. The truth is, we don't go to MRIs blindly and then MRI tells us what is there. No, we just do MRIs to confirm what we already suspect. So there's usually no, there are not many times when you get surprises from the MRI, because before the patient went off to MRI in the first place, you would have carefully examined them and taken history, and you would already have a clue about what is likely to be present. So it's at the end of that clinical encounter, we'll now make up our minds as neurologists whether this individual has any signs or telltale features suggesting an underlying structural problems for which they would need an MRI. Or it's just a simple headache that wouldn't need any further investigation. And when we do find some of those red flags in the history or on the clinical exam, then we'll decide that this person would need to do a scan or other forms of investigations or tests for that matter. So in this video and in my subsequent set of videos, I will be enlightening you further on some of those red flags that we look out for in the history and in the clinical exam to help us decide who's going to be needing MRIs or other tests for that matter. So one of such red flags or clinical indicators that we scout for in the exam or in interaction with patients is a new headache starting after the age of 45. So if I say somebody in my clinic who has no prior history of headaches, and I've tried my best to elicit that history, to dig out for it, to look for features that might suggest proneness to headaches from the past, and I do not find it, and it's obvious that this headache is just starting at the age of 45, perhaps it started just 1 month ago, 2 months ago, 3 months ago, 6 months ago, or a few weeks ago, then I would suspect that something must be underlying this headache, and therefore I may be recommending a head scan. And then there are other red flags that we look for, which I'll be talking about in my next set of videos, so please stay tuned for those videos. I do hope you learned something today, and if you did, please don't forget to subscribe and share the videos. And you can leave your comments and questions behind. I'll respond to them. Thank you once again for watching today. I'll see you next time. Bye for now.